everyone, welcome back to the Medicare Space channel. My name is Victoria Cabrera, and today we are going to be talking about what is a deductible. So I know I've been talking a lot about the different parts of Medicare and using certain terms, and I want to kind of rewind a little bit to go over the very basics of health insurance. And some of the information I want to go over today is going to be what is a deductible. So a deductible is a dollar amount, okay? And typically you'll see it in you see it in any type of insurance, right? You see it mostly in homeowners, you see it in car insurance, you see it in health insurance, but today I specifically want to go over deductibles regarding health insurance and pertaining to your Medicare plan or your Medicare Advantage plan, okay? So a deductible is a fixed dollar amount that the beneficiary or the insured, the person that's insured, is responsible for before the insurance actually kicks in, okay? So you really want to read into your benefits, because with Medicare, it's a little bit different. Deductibles are typically broken down in two separate parts. You have a Part A deductible and you have a Part B deductible. When it comes to your Medicare Advantage plan, what happens is the deductible has to do with defines in the policy. Maybe you have a deductible before the co-insurance kicks in for the hospital, or maybe you have a deductible before any insurance kicks in, before your co-pays and co-insurance kick in. So just keep in mind, anytime you see a deductible next to a certain line item of your benefits, you really want to understand, what pertains to that deductible. So for example, if you have a Medicare Advantage plan and you see a plan deductible, you need to find out if you have to meet that deductible before your copays kick in, your doctor visits, your preventive care. In most cases, preventive care is always covered prior to deductible. And usually office visit copays are too. But you'll see that in most health insurance plans, especially when you're not on Medicare, you're going to notice that you'll see these high deductible plans out there. Some might be $1,500, some might be $2,500, some might be $5,000, and up. I've seen them a lot higher too. So just understanding what a deductible is. The deductible is a dollar amount. It's a dollar figure that is associated to your health plan. And basically you are responsible to meet that deductible before the insurance kicks in, or before certain parts of the insurance kick in. So I want to break it down, because a lot of people say, well, Victoria, I have a $1,500 major medical deductible, or I have a $750 deductible, or I'm on Medicare and I have a $1,400 and $420 deductible, or $198 deductible. What these mean is basically you're responsible to pay. So let me use an example. Let's say, and I'll use a hospital situation, let's just say you have $1,000 deductible, okay, on hospital. If you were to be hospitalized and your bill was only $700, which we all know it'll probably be higher, but let's just say your total bill was $700, but your deductible was $1,000. Well, Victoria, because my deductible was higher, do I have to pay the whole $1,000, or am I just responsible for the $700? And in this particular case, you would only have to pay the portion of that bill up until your deductible is met. So once you've paid that $700 will deduct from that $1,000. So now your remaining deductible amount is $300. I hope that makes sense. So again, your bill was $700. Your major medical deductible was $1,000. You're not required to pay the $1,000 first. You're required to pay the $700. Okay, so unlike in some, like car insurance, mostly our deductibles are very low, so you usually end up having to pay that full deductible regardless. But in health insurance, it works a little bit different, because you will never pay If the bill is under the deductible amount, you're only paying the amount that you're responsible for. So again, a deductible is simply an amount, a fixed dollar amount assigned to your health plan that you are responsible for before certain parts of your insurance kick in. If you're on Medicare and you have questions about Part A deductible or Part B deductible, click on the video above, or go back in my channel and you'll see what is Part A deductible, what is Part B, and I'm going over how those particular deductibles work. But if you're simply on a health insurance plan through an employer sponsor plan, through Medicare, through a Medicare Advantage plan, and you just want to know what a deductible is, basically the deductible is your responsibility before certain parts of the insurance kick in. That's the easiest way I can explain it. And again, another tip is that you're not responsible to pay that whole lump sum deductible all at once if the bill is under that amount. Now, if the bill is over, so let's just say your deductible is $1,000 and your medical bill was $10,000, well, you would have had to pay that $1,000 first, right? That means you've satisfied your deductible. And then after that, your coinsurance or your copays will kick in. And I'm going to go over coinsurance in the next video. Thank you so much for joining in. And please be sure to subscribe to the channel. It helps out a lot. Anytime I put new videos out there, you're going to get notifications. You're going to be able to know when all the updates come up. So again, thank you so much, and we'll see you on the next video.